About which one?
Antabuse.
Ant abuse?
Uh-huh.
I don't know what ant abuse is.
It was on that chart I told you about. They will give them that when they're being discharged.
Oh, a medication? I'm sorry, I don't know what you're saying.
Okay, antabuse. They're going to give it to the alcoholic, okay? And what happens if he drinks while he's taking it?
Is that the one that
They're gonna
makes
get sick. They're
the
gonna throw
opioids
up.
don't work?
He is going to, uh, if he takes antabuse and he drinks alcohol, it can cause severe problems, okay? It will make him throw up things that he thought about eating. It will make him shaky, and whatever, it's going to cause his blood pressure to go up. He's going to have vital signs that are really messed up, and he's going to be in trouble. So that's antabuse, right? So somebody give me an example of codependent personality. Give me an example.
Is that when the old lady needs to rely on her husband to balance her checkbooks?
No, no, no. We're talking about alcohol now.
Oh hell, sorry,
Not
Miss
personalities. Oh hell. Oh hell. You're just killing me. Okay, so
It's when, like the little kid that's the oldest will have to take care of a younger sibling and possibly even their parent.
yeah, that's part of it. What about the wife calling in, for the husband saying he's sick?
Mm-hmm.
That's enabling, and that's part of the codependent diagnosis, okay? All right, so a nurse comes back from lunch and she's got slurred speech. Let me think, what else has she got? I don't see it. Where'd it go? Oh, slurred speech. Euphoria. She may be higher than a kite, right? Which of the following is the best action for the nurse to take?
Can I redeem myself?
Yes.
Report to the supervisor.
That's right. You're redeemed. Yay.
Thanks.
Brittany's back. Okay. That's good. All right. What about a drug overdose with a central nervous system depressant, which would be opioids or whatever? Which of the following is an antidote to treat inhalant toxicity?
Is it Narcan?
Nope.
Intensive care?
No. There's no treatment for inhalant toxicity. Okay, that's straight out of your book. Okay. Oh, I gave you the answer for the inhalant, not the CNS depressant. What happens with CNS depressants if they overdose with that?
The heart rate, respiratory rate slows way down.
Yeah. And so then what are you going to do for them? What's your care? If you're taking care of that patient, what would you be looking for?
Narcan? Naloxone.
Not treatment.
Oh.
What are you going to do?
Pray.
What part of the system are you going to be looking at if it's a central nervous system? Respiratory. You're going to monitor respiratory function. That's with CNS depressant overdose, okay? This is another codependency question. I think you would get this, so you don't need me. All right, so you've got a client back in. They've been in the program. They've been discharged. They're sober, whatever. And then they come in after they've had a relapse. They're in trouble. What's the nurse going to ask of this patient? Your choices are, I really thought you would make it. Tell me what's happened since your last admission. You have nothing to be ashamed of. Why do you start drinking again? Number two, that's right. Tell me what's happened since your last admission. Something went wrong, right? Something set it off, generally. Sometimes they just start drinking again, but that would be your best answer. All right, a nurse reports for work, looking unkempt and disheveled. Her movements are uncoordinated and her breath smells like mouthwash. Another nurse suspects this nurse is intoxicated. What should the nurse do first? We already had a similar question.
Talk to the supervisor?
Yes, supervisor, that's correct. All right, so if you're teaching about substance abuse, which would be the target audience, who would you want to teach about that if you were doing it first, okay? So who would your target audience be? Teenagers in high school in a health class, patients in a long-term care facility, parents attending a parent-teacher association meeting, elementary school teachers and counselors.
The teenagers.
Number one, teenagers in a high school health class. They're going to be more likely to start this abuse, if they haven't already, than all these other people. It would be more important to take them on, okay? All right, neurochemical influences on substance abuse patterns point to which of the following explanations as the probable cause of substance abuse? Your choices are imbalances of serotonin and norepinephrine in the brain, inhibition of GABA in the brain, GABA, excessive serotonin activity in the CNS, and stimulation of dopamine pathways in the brain. Number 4, stimulation of dopamine pathways in the brain. Oh, wrong page. Well, I did that out of place. Okay, the nurse is assessing a patient's risk factors for developing a substance abuse disorder. Which of the following family characteristics would the nurse identify as a significant risk factor? Risk factor. Who would be the most likely? What would be? Say that again.
People whose parents were alcoholics.
Children of alcoholics are 4 times more likely, right? 4 times more likely. So in this case, the significant risk factor would be that they've got one or both parents drinking or doing drugs or whatever. Okay, risk factors for developing a substance abuse disorder. Oh, I just said that. Patient reports drinking 1 to 2 drinks when drinking behavior first began. Now the patient reports drinking at least 6 with every episode in order to have a good time. He's describing what?
Tolerance.
Yes, tolerance. Brittany, you came back good. I just have to poke fun. All right. 12-step programs for recovery consist, wait a minute, which of the following is consistent with the principles of 12-step programs?
Admitting you have a problem.
That's one.
Ace would
Okay.
be Alcoholic Anonymous.
Let me give you your choices. The patient will need to abstain from all substances for successful recovery. Once sober, the person can safely return to life as it was before becoming addicted. The prognosis for recovery is enhanced with the aid of maintenance medications. Recovery requires adherence to a plan of achieving long-term goals.
One.
It's one. The patient will need to abstain from all substances for successful recovery. They can't go through a program and go, okay, I'm cured, and then go back to drinking. They have to abstain for the rest of their life. It's a hard deal. Okay. The nurse is assessing a patient's history. Okay. Admitted for alcohol abuse. Statements reflects the most probable patient statement is at this time. So you're admitting this guy or girl. So what's the first thing that they're going to say? First thing.
That
What'd you
there's
say?
a problem. That they don't have problem.
Exactly. I don't really have a problem with alcohol. I've just been having a run of bad luck. Okay. Assessing a client with anxiety, the nurse's question should be, I'll give you your choices. Avoid it until the anxiety's gone, open-ended, postponed until the client volunteers information, specific and direct.
Two.
So what should your questions be?
Open-ended.
Nope.
Specific and direct.
Yes. Specific and direct. Who got that? Somebody got that.
Karina.
Okay. Huh? Okay, so a patient is in treatment for drug abuse, makes the statement, I'm a winner. You're all losers because you can't beat this on your own. And the nurse says, and the nurse interprets this statement as reflecting which characteristic common to people addicted to drugs. You want your choices? Realistic understanding of successful recovery of drug addiction, indication of an underlying personality disorder, brain damages resulting from chronic drug use, defending against a negative self-concept. I'm a winner, y'all are the losers, right? It's number 4. Good job. Okay, a patient's being discharged from treatment for addiction to cocaine. Which of the following statements made up by the patient would cause the most concern for the nurse? I'm going to take up a new hobby. I can still hang out with my old friends. I'm just not going to use. I'm not very comfortable with being alone yet. Shooting baskets helps me not think about getting high. Shooting baskets meaning basketball. Yep, it's number 2. I can still hang out with my friends. I just won't. Yeah, no. Doesn't work that way, unfortunately. A patient is being discharged on disulfiram, which is antabuse. The patient should receive which of the following instructions related to the use of antabuse? Take it with food to avoid stomach upset. Skip the daily dose on days when consumption of alcohol beverage is likely. Read product labels carefully to avoid all products containing alcohol. Disulfiram will prevent the desire to drink alcoholic beverages. What you got?
Labels.
3, y'all got it. Read product labels carefully to avoid all products containing alcohol. The patient asks the nurse, what will happen if I drink while taking Antabuse? We just said that, right? You'll have severe reaction, including, go away. Stop it. I'm just going to scream at my phone. That helps, right? All right. You will have severe reaction, including a throbbing headache and vomiting. Okay. A nurse is exploring treatment options with a patient addicted to heroin. The nurse would include which of the following information regarding the use of methadone? Okay. Unlike heroin, methadone is non-addictive. Methadone will meet the physical needs of opiates without craving for more. Methadone will produce a high similar to heroin. People taking methadone run the same risks associated with IV drug use as those taking heroin. What we got? 2. Methadone will meet the physical needs without the need for opiates. Okay, the nurse is co-leading a family therapy group with a patient addicted to alcohol. Which statement made by the wife indicates the need for additional education regarding alcoholism? Oh, as a family illness. All right, so one is I have to call in sick for my husband when he's too hungover to go to work. Last time he got arrested, I just let him sit in jail. 3, we have separated our finances so that I will not go broke. And D, I take my kids with me to Al-Anon meetings every week. So this is one of those, a couple of them are right answers. You got to pick the most correct answer, okay? Number 1 is correct. I have to call in sick for my husband. That's the codependent thing, right? So that would be all of the following except, or that would be the one where she needs more education. All right. I'm trying to keep my pages correct, but I never do. All right. A client experiencing alcohol withdrawal is upset about going through detox. Which goal is the priority? The client will commit to a drug-free lifestyle. The client will work with the nurse to remain safe. The client will drink plenty of fluids on a daily basis. The client will make a personal inventory of strengths. Number 2, it's got the word safe in it, right? And are these clients, do you think these clients are more likely to hurt themselves or others? Yep. Client recovering from alcohol addiction asks a nurse how to talk to his children about the impact of his addiction on them. Which response by the nurse is most appropriate? Try to limit references to the addiction and focus on the present. Talk about all the hardships you've had in working to remain sober. Tell them you're sorry and emphasize that you're doing so much better. Talk to them by acknowledging the difficulties and pain your drinking caused. Number 4, You got to just admit it and, apologize. All right. A client with alcoholism has just completed a residential treatment program. What can this client reasonably expect? Her family will no longer be dysfunctional. Right. She'll need ongoing support to remain abstinent. She doesn't need to be concerned about abusing alcohol. She can learn to consume alcohol without problems. 2. That's correct. 2, yeah. The nurse is co-leading a family therapy group for patients and families of drug-addicted individuals. The family of a cocaine addict is angry and can't understand why the patient can't just stop using. The nurse counsels the family and concludes that the family had a better understanding of addiction when they agree, select all. A, it's a medical illness that is progressive. B, the patient will eventually be cured. C, relapses and remissions are part of the illness. And D, patients can learn to get control over the substance. Brittany, you can only have one answer.
I thought you said
I thought you said
select all.
select all.
You said select
I
all.
know.
A and C?
It's A and C.
Oh.
Sorry, Brittany, I didn't mean to pick on you.
I'm the one that's getting picked on today.
You are. It's because
Can you just repeat what A was? Because I must not have gotten that right.
it's a medical illness that is progressive.
Okay, thank you.
And the other one is relapses and remissions are part of the illness. Okay. A nurse is developing strategies to prevent. Y'all need to turn off your microphones. I'm getting this, whatever, echoes. You can turn them back on when you have the answer. Okay? All right, so a nurse is developing strategies to prevent relapse with a client who abuses alcohol. Which client intervention is important? A, avoiding taking over-the-counter medications, limiting monthly contact with the family, refraining from becoming involved in group activities, avoiding people, places, and activities from the former lifestyle. It's D, yeah. All right, a nurse whose license is suspended for misappropriation or medications and drug use while at work, and you need to finish the sentence. A, can get her license back on a restricted basis after rehab. B, can no longer practice as a nurse. C, can get her license back but never give medications again. And D, can in most cases get her license back after certain steps have been taken to accomplish rehabilitation and may require a limited license regarding medication. It's D. Okay, you got it. So she's got to do more than just, going into some program. It would require an inpatient for however many days. They usually do it for 30, 60, or 90 days. All right, so I think they would require her probably to do 60. I think somewhere in your book it says 30, but at the VA, this is my most experience with mental health. We did do one in Murfreesboro, but it was less interesting. What have I done? I did something to the thing. There we go. See if I can. I didn't get rid of that. There. Okay. So at the VA, when they finish their 5 days or however much their treatment turned out, they would discharge them to a 30, 60, or 90-day program. They would commit to the 30-day. They hated the 60, and they really hated the 90-day programs. And there aren't very many 90-day programs out there. There's one called Pennyrile something or other, which is in Kentucky. And so they're away from their families and, you know, all that. They don't want to be in treatment anyway. All right, so I think I've got the wrong page. All right. 5,000 deaths occur each year due to alcohol use in persons under the age of 21. These are categorized as follows. A, missing work on Monday and Friday. B, accidental injuries in the home. C, suspension of driver's license for DUI. And D, motor vehicle accidents, homicide, and suicide. That's right, it's D, okay. While they do have these other symptoms and whatever, you got to pick the best right answer, right? And the question is they're categorized as follows. So it should indicate to you that there's more than one part, right? So you have to think about how to answer questions, not just the right answer. And you have to pick out those significant terms in the question, and you have to see how the answer relates to the question. It's called critical thinking, right? Thinking like a nurse. Thinking like a nurse. All right. A nurse is admitting a 17-year-old patient in the ER and notes the smell of alcohol and slurred speech. The nurse suspects alcohol intoxication, and her supporting reason is that A, the early course of alcoholism typically begins much earlier, with the first episode of intoxication between the ages of, the first one is 12 and 14. The second one is between 17 and 18. The third one is the first episode of intoxication in the mid-20s. And the last one is the first episode of intoxication after a life-altering crisis. So the first episode. Judith, move your hand over a little bit. I can't see it. Put it towards your face. Yeah. So it's A, okay. The early course of alcoholism typically begins much earlier, with the first episode of intoxication between the ages of 12 and 14. We said that the first time they just kind of sipped or tasted or whatever is younger than that. Younger individuals who experiment with substances will generally experiment with drugs that carry less social approval. Examples include Xanax and cocaine, Atarax and Valium, alcohol and cannabis and cocaine. What do you think? So what did we say about young people? They're going to go with something that's less expensive. That's the first thing that should go through your mind. Cocaine's expensive, okay? You're not going to find Atarax on the street or wherever. So it's alcohol and cannabis. It carries less social, criticism or whatever. It's more acceptable. And it's cheaper. It's less expensive. I have no idea what it costs. I do know that both are readily available if you want it. Okay, a patient is admitted to your facility for safe withdrawal from alcohol. You would expect the physician to order. All right, these are medications. Lithium Integritol, MAOIs or SSRIs, Tegretol or Dilantin, Ativan or Librium. What do you choose? Four is right. Carolyn got it. So it's Ativan or Librium. That's on that medication chart. And it also mentions it in the dialogue, the paragraph. Okay, an illegal drug with virtually no clinical use in medicine is cocaine, clozaril, dexedrine, cannabis. Number 1, cocaine. Okay. A nurse will recognize intoxication in an individual abusing stimulants if he appears with the following symptoms: constricted pupils and bradycardia, dilated pupils and elevated blood pressure, dilated pupils and bradycardia, hyperthermia, and chest pain. It's B, you're right. Dilated pupils and elevated blood pressure. Alcohol withdrawal is usually managed with a benzodiazepine. The most commonly used benzodiazepines are Haldol and Prolixin, Ativan and Valium, levomethadil and naltrexone, Ativan and Phenergan. It's 2, Ativan and Valium. Okay, so you're not going to go to Haldol and Prolixin. That's the first one. Levomethadil and naltrexone. I have no idea what those are. You need to learn those. I don't. I'm supposed to already know them. Ativan and Phenergan. No. Ms. Belsky says I don't need to tell you the things I don't know. Sorry. I can only keep them in my head so long, and I've been doing this for 28 years, I think. 28? Yeah, I think so. Anyway. Okay. The ingestion of mood-altering substances stimulates some kind of pathways in the limbic system. They produce that high feeling.
Dopamine?
Dopamine.
Yes, dopamine pathways. That's right. Marked withdrawal symptoms from stimulants is called crashing. The person may experience A, euphoria and talkativeness, B, depression and dysphoria, C, hypertension and tachycardia, D, night sweats and hypertension. Crashing.
Depression.
Yeah, it's 2. Okay, depression and dysphoria. So if they're crashing, that means they're coming down. So you need to pay attention to those words, right? And it's explained in your book, and there's a whole bunch more to it, but that word crashing should tell you that it's going to be a downward spiral. Some people use alcohol as a coping mechanism. High doses of alcohol, however, A, increase awareness and self-confidence, B, increase muscle tension and nervousness, C, increase self-consciousness and psychological pain, D, increase hostility and awareness. I've got 1, 2, and 3. All right, so the answer is, where am I? Increase muscle tension and nervousness. It says at the end of that paragraph that people take it, and whatever. When they're depressed, they think, like at school, when you do badly on an exam, you'll say, I'm going to go home and get drunk. Well, it's not going to do you any good. It's going to increase muscle tension and nervousness. A nurse creating a care plan for a patient with a dual diagnosis would recognize which of the following as a priority nursing diagnosis. A, risk for self-mutilation. B, social isolation. C, low frustration tolerance. D, ineffective coping. What are we at? 1. That's right. Risk for self-mutilation. What is that? That is a safety question. Okay? When we talk about mental health, that's one of the first things we want to know is safety. Okay, where am I? All right. Which of the following behaviors would indicate stimulant intoxication? Slurred speech, unsteady gait, impaired concentration. B, hyperactivity, talkativeness, euphoria. C, relaxed inhibitions, increased appetite, distorted perceptions. And D, depersonalization, dilated pupils, visual hallucinations. It's B. Okay, good job. Clonidine or Catapres is prescribed for symptoms of opioid withdrawal. Which of the following nursing assessments is essential before giving a dose of this medication? A, assess the client's blood pressure. B, determine client's last use. Monitor for tremors. Complete a thorough physical. One, that's right. Erica got it first. Okay, so this is a blood pressure medication that they give for withdrawal. Okay, so you want to take that blood pressure before you give the medication. If their blood pressure is already low, you're not going to give them more medication to lower their blood pressure. A client with a history of alcohol abuse refuses to take vitamins. Which statement is most appropriate for explaining why vitamins are important? A, it's important to take vitamins to stop your craving. B, prolonged use of alcohol can cause vitamin depletion. C, for every vitamin you take, you'll help your liver heal. D, by taking vitamins, you won't need to worry about your diet. It's B. Y'all are good. Prolonged use of alcohol can cause vitamin depletion. This is like the second or third 12-step AA program, and I told y'all, I didn't go through that very carefully, so y'all need to go back and look at the AA 12-step program. All right, so 12 steps, the 12 steps of AA teach that. A, acceptance of being an alcoholic will prevent urges to drink. B, a higher power will protect individuals if they feel like drinking. C, once a person has learned to be sober, he can graduate or leave AA. D, once a person is sober, he remains at risk to drink. D, good job. Some people can stop drinking on their own without a treatment program. This is called spontaneous sobriety, self-absorption, spontaneous remission, permanent remission. 3, you're right. It's called spontaneous remission. People often seek treatment for mental illness when it affects problems with personal hygiene and cognitive alterations, problems with work and personal relations, problems in school and handling money, problems with concentration and sleep patterns. It's B. Good job. Problems with work and personal relations. So it left out the legal system, right? It starts with jobs, family, and the legal system. I know I've hammered y'all with that, but it applies, okay? Just trust me. Just trust me. All right, so the nurse would assess for which of the following characteristics in a client with narcissistic personality disorder. All right, so your choices are entitlement, fear of abandonment, hypersensitivity, and suspiciousness. It's 1, entitlement. They think they deserve it. All right, which of the following typifies the speech of a person in the acute phase of mania? A, flight of ideas. B, psychomotor retardation. C, hesitant. D, mutism. Number 1, flight of ideas. They're just all over the place, aren't they? All right, so that's all I've got. Now, when y'all have questions, about my questions.